Lesson number 7, Endoscopy. By the end of this lesson, you should be able to explain the role of total internal reflection in the transmission of light along an optical fiber, and describe the use of optical fibers in endoscopes, and give examples of the use of endoscopes. An endoscope is a slender tube which allows the doctor to look into the passageways of the body without having to operate. It can be inserted through the mouth or other natural openings. Alternatively, a small cut can be made in the skin to allow inspection of the chest, abdomen or a joint, to take samples or to remove obstructions and diseased areas. Endoscopes consist of a rigid or flexible tube containing glass fibers called optical fibers. The endoscope allows the transmission of light into and out of the body. It has a light source attached, and the light passes along one set of optical fibers, down the endoscope and out at the other end. The light is reflected off the objects inside the body, and then the light travels back up a different set of optical fibers to the eyepiece. The doctor looks at the image through the eyepiece, or it is displayed on a screen. The light travels down the optical fibers by total internal reflection. The optical fibers are made of 2 layers of glass of different densities. On the inside there is high-density glass, surrounded by an outer cladding or coat of low-density glass. The light hits the boundary between the 2 layers above the critical angle, and so is reflected back. This ensures that light entering one end will travel all the way to the other end without leaving the edges of the fiber by refraction. At the end of the endoscope, the light is reflected off a surface inside the body. It then travels back through the glass fiber, each time being reflected from the boundary with the low-density glass. Most endoscopes are flexible, and movement is controlled by buttons next to the operator's eyepiece. On some, there are switches and controls to send in air or water or to suck out air. Some endoscopes have attachments which allow the doctor to remove pieces of tissue or to cauterize them. Medical uses of endoscopes include arthroscopy, looking inside and treating joints; bronchoscopy, looking for tumors, abscesses and tuberculosis in the lungs; colonoscopy, examining the large intestine for ulcers and inflammation; cystoscopy, used for the bladder, urethra and prostate; gastroscopy, looking at the lining of the esophagus, stomach and duodenum; laparoscopy, an incision in the abdominal wall to see the fallopian tubes, stomach, liver and other organs.